Stroke is a medical emergency that occurs when the blood-supplied part of the brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrients. Within minutes, brain cells begin to die. The classic definition of stroke is a rapidly developing clinical sign of focal or global disturbance of cerebral function, lasting more than 24 hours or leading to death, with no apparent cause other than a vascular origin. Understanding what a stroke is sets the foundation for recognizing its seriousness and the urgency required in its management. Strokes are broadly classified into two main types, ischemic and hemorrhagic. Ischemic strokes occur when a blood vessel supplying the brain is blocked, usually by a blood clot. Hemorrhagic strokes, on the other hand, happen when a blood vessel ruptures, causing bleeding in or around the brain. Each type has distinct causes, symptoms, and treatment approaches. Recognizing the type of stroke is crucial for determining the appropriate intervention and improving patient outcome. Ischemic stroke is the most common type, accounting for about 85% of all strokes. It occurs when a blood clot blocks or narrows an artery leading to the brain. The blockage can be due to a thrombus, a clot forming in the brain itself, or an embolus, a clot formed elsewhere, often in the heart, that travels to the brain. The result is a sudden reduction in blood flow, depriving brain tissue of oxygen and nutrients, which can lead to permanent damage if not treated quickly. Hemorrhagic stroke occurs when a blood vessel in the brain ruptures, leading to bleeding within or around the brain. This bleeding increases pressure on brain tissue and can cause significant damage. There are two main types: intracerebral hemorrhage, where bleeding occurs within the brain tissue, and subarachnoid hemorrhage, where bleeding happens in the space between the brain and the surrounding membrane. Both types require immediate medical attention. Transient ischemic attack, or TIA, is often called a mini-stroke. It happens when blood flow to part of the brain is blocked for a short time, usually less than 24 hours. Symptoms are similar to those of a full stroke but are temporary and resolve completely. However, TIAs are serious warning signs that a major stroke may occur in the future. Immediate medical evaluation and intervention are essential to prevent a full-blown stroke. Ischemic strokes can be further divided into embolic and thrombotic types. In embolic stroke, a blood clot forms elsewhere in the body, often the heart, and travels to the brain, blocking a blood vessel. In thrombotic stroke, the clot forms directly in an artery supplying the brain. Both types result in reduced blood flow and oxygen to brain tissue, but their origins and risk factors may differ. Understanding these differences helps guide prevention and treatment strategy. Subarachnoid hemorrhage is a specific type of hemorrhagic stroke where bleeding occurs in the space between the brain and the thin tissues covering it. This condition is often caused by the rupture of an aneurysm and can lead to sudden, severe headache, nausea, vomiting, and loss of consciousness. Subarachnoid hemorrhage is a life-threatening emergency and requires rapid diagnosis and intervention to prevent further brain injury. Recognizing the symptoms of stroke early can save lives. Common symptoms include sudden numbness or weakness, especially on one side of the body, confusion, trouble speaking or understanding speech, vision problems, severe headache, dizziness, loss of balance, and difficulty walking. Some patients may also experience nausea, vomiting, seizures, or loss of consciousness. If you notice any of these signs, seek emergency medical help immediately. Several factors increase the risk of stroke. These include high blood pressure, diabetes, high cholesterol, smoking, obesity, physical inactivity, and excessive alcohol consumption. Other risk factors are age, family history, certain heart conditions, and previous strokes or TIAs. Some triggers like pregnancy or neck trauma can also play a role. Understanding and managing these risk factors is key to stroke prevention. Pathophysiology of stroke involves the sudden loss of blood flow to brain tissue, leading to cell death. The timing and extent of permanent injury depend on the site of the blockage or bleeding, the vulnerability of brain cells, and the size of the affected area. Early restoration of blood flow can limit damage, but delays can result in irreversible injury. The brain is especially vulnerable due to its high metabolic activity and reliance on constant oxygen supply. Body's vascular response plays a significant role in stroke outcomes. Factors like nitric oxide production can influence how blood vessels react to injury. In some cases, early recovery of blood flow can reduce brain damage. However, if blood flow is not restored quickly, brain tissue may remain viable for only a few hours before permanent injury occurs. This highlights the importance of rapid intervention in stroke management. Coagulation and vascular inflammation are key mechanisms in stroke development. Theories suggest that the activation of the coagulation cascade and inflammation within blood vessels contribute to the risk and severity of stroke. Elevated inflammatory markers and leukocytosis are often associated with poorer outcomes in acute stroke cases. Understanding these processes can help guide targeted therapies and improve prognosis. Brain is highly susceptible to hypoxic injury due to its high metabolic demands and reliance on oxygen. When blood flow is blocked, the resulting lack of oxygen and nutrients leads to rapid neurological effects. Glutamate release and metabolic disturbances further contribute to cell damage. The extent of permanent injury depends on how quickly blood flow can be restored and the specific area of the brain affected. Emboli, or blood clots that travel through the bloodstream, often originate from the left atrium, left ventricle, or carotid artery. When these emboli reach the brain, they can block blood vessels and cause an ischemic stroke. The timing and severity of injury depend on the location of the blockage and how quickly treatment is initiated. Identifying the source of emboli is important for preventing future strokes. In many cases, the exact cause of a stroke remains unclear. While risk factors and mechanisms like coagulation and inflammation are known, some strokes occur without an identifiable trigger. This uncertainty can make prevention challenging, but ongoing research continues to uncover new insights into stroke mechanisms and potential interventions. Timing of permanent brain injury after a stroke varies based on the site of the blockage or bleeding, the vulnerability of the affected cells, and the extent of the lesion. Some brain tissue may remain viable for hours after blood flow is interrupted, but rapid restoration is crucial to prevent irreversible damage. This underscores the importance of immediate medical attention when stroke symptoms appear. First steps in managing a stroke are critical for determining outcomes. Stabilizing the patient, ensuring proper oxygenation, and maintaining hemodynamic stability are top priorities. Identifying factors that could worsen the situation, such as high blood pressure or low oxygen levels, is essential. Early assessment for eligibility for thrombolysis therapy can make a significant difference in recovery. Aspirin is commonly prescribed for long-term therapy to prevent further strokes. Dual antiplatelet therapy, such as aspirin plus clopidogrel, has been shown to lower the risk of recurrent stroke when started early after a mild stroke. However, the use of certain medications like unfractionated intravenous heparin is not routinely recommended except in select high-risk groups. The choice of therapy depends on individual patient factors and risk profile. Thrombolytic therapy, such as alteplase recombinant, is used to dissolve blood clots in eligible patients within 4.5 hours of symptom onset. This treatment can significantly improve outcomes if administered promptly. However, not all patients are eligible due to potential side effects, including bleeding and damage to the blood-brain barrier. Early initiation of thrombolytic therapy is crucial for maximizing benefits. Dual antiplatelet therapy (DAPT) involves using two medications, typically aspirin and clopidogrel, to reduce the risk of recurrent stroke. This approach is especially effective when started early after a mild stroke. A loading dose is usually given, followed by maintenance therapy. DAPT is not suitable for all patients, so careful assessment is necessary to balance benefits and risks. Managing blood pressure is a key aspect of stroke care. Medications such as labetalol or nicardipine are used to control hypertension, which can worsen outcomes if left unchecked. However, early aggressive blood pressure reduction is generally avoided in the acute phase to prevent further brain injury. The goal is to maintain optimal blood flow to the brain while minimizing risks. If a stroke patient was on anticoagulant therapy, reversal agents may be needed to reduce bleeding risk. Protamine sulfate is used for heparin, while vitamin K is used for warfarin. Rapid reversal is especially important in hemorrhagic stroke to prevent further bleeding and complications. The choice of agent depends on the specific anticoagulant the patient was taking. Mechanical thrombectomy is a specialized procedure for ischemic stroke, involving the removal of a blood clot using a catheter. This intervention is typically performed within 6 to 24 hours of symptom onset and is reserved for select patients with large vessel occlusion. Mechanical thrombectomy can dramatically improve outcomes when performed promptly and by experienced teams. For patients with large or symptomatic hemorrhages, surgical removal of the blood clot may be necessary. Hematoma evacuation can relieve pressure on the brain and prevent further damage. The decision to operate depends on the size and location of the hemorrhage, as well as the patient's overall condition. Timely intervention is crucial for the best possible recovery. In cases of severe brain swelling after a stroke, a decompressive craniectomy may be performed. This surgical procedure involves removing part of the skull to relieve pressure and prevent further brain injury. It is typically reserved for life-threatening situations where other treatments have not been effective. The goal is to give the brain space to swell safely and recover. A hemorrhagic stroke is caused by a ruptured aneurysm. Surgical interventions like clipping or endovascular coiling may be performed. Clipping involves placing a small clamp at the base of the aneurysm, while coiling uses tiny coils to fill the aneurysm and prevent rebleeding. Both procedures aim to secure the blood vessel and reduce the risk of future hemorrhage. Lifestyle and behavioral changes are essential for stroke prevention and recovery. Key recommendations include quitting smoking, reducing salt intake, avoiding excessive alcohol, losing weight, and engaging in regular physical activity. These changes not only lower the risk of stroke but also improve overall cardiovascular health. Support from healthcare professionals can help patients make and maintain these important adjustments. Stroke can lead to a range of complications including fever, hyperglycemia, hypertension, swelling, edema, and herniation. These complications can worsen outcomes and may be fatal if not managed properly. Early recognition and treatment of complications are vital for improving recovery and reducing the risk of long-term disability. Fever and high blood sugar levels are linked to poor outcomes after stroke. Controlling glucose levels and treating fever with medications like paracetamol are important steps in post-stroke care. Monitoring and managing these complications can help prevent further brain injury and support the recovery process. Swelling, edema, and herniation are serious complications that can occur after a large stroke. Unfortunately, there are currently no approved treatments for these conditions, and they are often fatal. Preventing and managing other complications as well as close monitoring are essential for improving outcomes in patients at risk for severe brain swelling. Patients recovering from stroke are at increased risk for thromboembolic complications such as deep vein thrombosis (DVT) and pulmonary embolism. Without proper prophylaxis, these conditions can be life-threatening. Preventive measures include the use of compression stockings, adequate hydration, aspirin, and early mobilization to reduce the risk of blood clots. The effectiveness of compression stockings in stroke patients is not well established, but they are often used along with hydration and aspirin to prevent thromboembolic complications. Early mobilization is also encouraged to reduce the risk of blood clots. Each preventive measure should be tailored to the individual patient's needs and risk factors. Urinary catheters are generally avoided in stroke patients due to the high risk of infection. Alternative methods for managing urinary issues are preferred whenever possible. Preventing infections is a key part of post-stroke care and can help improve overall outcomes. Rehabilitation is a critical component of stroke recovery. It includes exercises to improve mobility, strength, and coordination, as well as therapies to help patients return to daily activities. The goal is to maximize independence and quality of life by addressing both physical and cognitive challenges resulting from the stroke. Physical therapy focuses on helping stroke patients regain strength, balance, and coordination. Therapists design individualized exercise programs to improve mobility and prevent complications such as muscle stiffness and joint contractures. Regular physical therapy sessions are essential for promoting recovery and enhancing the patient's ability to perform daily activities. Occupational therapy helps stroke survivors relearn skills needed for daily living, such as dressing, eating, and bathing. Therapists work with patients to develop strategies and adaptations that promote independence. The focus is on improving fine motor skills and enabling patients to return to their normal routines as much as possible. Speech-language pathologists assist stroke patients who have difficulty speaking, understanding language, or swallowing. Therapy may include exercises to strengthen muscles, improve communication, and teach alternative ways to express needs. Early intervention can greatly enhance recovery and quality of life for those affected by speech or swallowing difficulties. Preventing a second stroke is a major focus after the initial event. This involves strict control of blood pressure, cholesterol, and blood sugar, as well as adherence to prescribed medications. Lifestyle modifications, regular follow-up with healthcare providers, and ongoing rehabilitation all play a role in reducing the risk of recurrence. Long-term management of stroke includes ongoing medical care, rehabilitation, and support for both patients and caregivers. Regular monitoring of risk factors, medication adjustments, and participation in support groups can help patients adapt to life after stroke. The goal is to maintain health, prevent complications, and maximize independence. Education is a vital part of stroke recovery. Patients and families need to understand the nature of stroke, risk factors, warning signs, and the importance of medication adherence and lifestyle changes. Empowering patients with knowledge helps them take an active role in their recovery and reduces the risk of future strokes. Pharmacists play a crucial role in patient counseling, medication management, and education. They help ensure that patients understand their medications, potential side effects, and the importance of adherence. Pharmacists also provide guidance on lifestyle modifications and support patients in managing risk factors for stroke. Support systems, including family, friends, and community resources, are essential for stroke recovery. Emotional support, assistance with daily activities, and encouragement can make a significant difference in a patient's rehabilitation journey. Connecting with support groups and rehabilitation services can provide additional help and motivation. Regular monitoring and follow-up appointments are important for tracking progress, adjusting treatment plans, and addressing any new or ongoing issues. Healthcare providers work closely with patients to ensure optimal recovery and prevent complications. Consistent follow-up helps maintain health and supports long-term success after stroke. Stroke care involves rapid recognition, immediate intervention, and comprehensive rehabilitation. From emergency management to long-term support, every step is crucial for improving outcomes and quality of life. By understanding the types, causes, symptoms, and treatments for stroke, patients and caregivers can take proactive steps to prevent recurrence and support recovery. Ongoing research and advances in medical care continue to improve stroke prevention, treatment, and rehabilitation. Staying informed about new developments, maintaining healthy habits, and working closely with healthcare providers are key to reducing stroke risk and enhancing recovery. With the right support and resources, stroke survivors can achieve meaningful recovery and a better quality of life.